Liposuction is a procedure where excess fat cells are removed by suction, as the name implies, and by doing so, you can improve the figure. Now, this is a procedure works best for those who have lipodystrophy, and lipodystrophy is a condition where developmentally you have more fat cells in a particular area, and it tends to be more fuller, and as a result harm or affects your figure. So if you suction those areas out, you reduce the fat cells there, and then you equalize the fat cells so that your figure is harmonious. Once that is done, then it's up to the patient to maintain it with diet and exercise. So this works best in someone who is dieting and exercising and trying hard to reduce the excess but not succeeding in those particular areas. That's where liposuction works best. But there's also another class of patients who come who are obese, who are overweight and want reduction. They may have tried or may not have tried and have failed, and in those cases they come to you for liposuction. Here we do a generalized suction, but the first category you get the best results and they are maintainable. Now, liposuction is a procedure where there are various types of liposuctions. The oldest method is just using a suction machine to suck using cannulas. Then came the development of power assisted liposuction or PAL, and now what I use is laser assisted liposuction, which is using ultrasound. So we first infiltrate a fluid in the fat to make it kind of liquid, and then I use an ultrasonic probe to emulsify the fat. This helps the fat to be selectively destroyed, preserving all the nerves, arteries, vessels in that area. And then suction cannula is used, which are tiny 2 to 3 millimeter size cannulas, and you suck the fat out using a moderate suction machine, and the fat is pure fat that comes out with very little blood. That's the beauty of Vaser, and the fat which is removed permanently. The lattice work or the empty kind of framework that is left behind after the fat has been suctioned out, that tends to accumulate swelling fluid or edema for a few days. If you wear a nice compression garment or you massage the area, the swelling settles, and by 3 to 4 weeks time most of the swelling is settled and you get a permanent improvement, which all you have to do is maintain with diet and exercise. The cost of liposuction would vary upon according to the areas that we are suctioning and also the technology that we are using. So if it is just a suction assisted liposuction, the cost could be anywhere from 15 to 20,000 per zone, or if you're using a power assisted, it could be up to 25,000 a zone, and if you're using Vaser, it could be 35,000 per zone. Zone or area would be, for instance, upper abdomen, lower abdomen, the flanks, the lower back, both sides obviously, hips, buttocks, thighs. So these are various zones or areas that you are treating. So every zone takes an hour of work, doing the 3-step process, and that's why the cost is calculated depending upon the amount of work that is required and the hours or the anesthesia time and all of that. So it's better to have it zone wise so that eventually you can have a proper costing done.